Good evening, and welcome to STAN. Tonight we will be discussing the recent ringworm outbreak at Ohio Northern University. We will be even talking to a real live ONU wrestler, that is, if he's still capable. We'll also be discussing the topic with the world-renowned ringworm specialist, Dr. Tim Barnett. Stay tuned after this short commercial break.
Look, we've all dealt with the itching of athletes. I can't just wash it away. Killing it takes clinical strength. I only use Lotrimin Ultra. Its powerful formula can even cure severe cases of athletes. Nothing cures better. Lotrimin Ultra, the killer cure.
Thanks for sticking around. Ringworm, medically known as dermatophytes, is a fungal infection. It's actually the most common fungal infection in humans. It can be spread from person to human, animal to human, or from soil to human. It normally resides in warm, moist places, such as locker rooms and swimming pools. That is why it's so common for athletes to get it, especially wrestlers. Which is also why we sent our field reporter, Nikki, into the war zone that is ONU's Kinghorn today to talk to a real live wrestler. How you doing, Nikki?
Hey, Sarah. I'm a little scared and nervous about getting this dreadful disease called ringworm, but it's all part of my job. This is my friend Andy, who's a wrestler here at Ohio Northern University, and he just so happens to be carrying this plague called ringworm. He's currently sidelined due to this illness since it's a very contagious via skin-to-skin contact. Andy, when did you first realize something was wrong?
Well, when I was wrestling one day, I noticed a red ring on my arm. It was kind of raised, and it just didn't seem right, so I went to the doctor.
So what does this ringworm disease look like?
Well, as you can see right here, it's just a little red raised bump on my arm.
It really does look like a ring made of worms. How bad did that hurt?
Actually not too bad, it just itched a little bit.
So I assume you went to the doctor when you noticed the ringworm? What did your doctor tell you to do?
He told me no big deal. He said just go ahead and go to the pharmacy and grab the over-the-counter medicine, Lotrimin. I said you're supposed to clean it first, go ahead and apply as much as you need for 2 times a day for about 2 weeks, and it should clear up.
So your wrestling career is not over then?
Nope, just for 2 weeks.
Well, there you have it from the disease-ridden person himself. If you're as terrified about ringworm as I am, here are some things to keep in mind in order to help prevent getting this dreadful disease. Keep your skin clean and dry. Dry yourself completely after showers and dry your feet last. Wash hands often to avoid spread of infection. Avoid sharing clothes, sheets, towels. Avoid sharing hairbrushes, razors, and headgear, especially for wrestlers. And if infected, clean and dry after each use. Wear shoes in public areas, pools, locker rooms, and bathrooms. Avoid walking barefoot at all times. Shower and shampoo after sports. Use antifungal shampoo 2 times a week if you do become infected. Wear clean cotton clothing that has a loose fit to help prevent sweating. Maintain good general hygiene. And if your pet has patches of hair missing, take the pet to the vet because, like we heard earlier, it can be spread from animals. And then finally, if you do become infected or think that you might be infected, disinfect your bathrooms, sinks, and the floors as well with bleach, just in case. Well, thank you very much, Andy, and good luck ONU wrestling team this year. Try to stay uninfected.
My name is Robert Hawkins. Approximately 7 hours ago, something attacked the city. You found this. If you're watching this, then you know more about it than I do.
Whatever it is, it's winning. Do you have any idea what's on? I don't care what's on there. Listen to me. She's dying. Camera.
Thanks, Nikki. I'll definitely be taking a few more showers per day now. Dr. Tim, it's nice to have you on the show.
Great to be here.
Doc, tell us more about this ringworm that we're all fearing.
Well, it's a fungus, and like you said, it transfers from soil, animals, or humans through arthrospores, and these spores germinate on the skin, the epidermis of the skin, and they secrete proteinases that aids in the penetration of the fungus. And the way it attaches is it generates the hyphae, and they penetrate the hair follicle via the penetrating organs, and they enter the hair cortex, and they then adhere to the keratinocytes, and this helps penetrate the stratum corneum. And the way it overcomes the host defenses is that the hyphae remain in the epidermis away from the antibodies and the immune system cells, and it causes damage to the hair shaft and the growth around that, sometimes causing bald spots and inflammation or irritation, and then it exits by forming a spore, which eventually shed and are spread to other organisms.
So basically what you're saying is the ringworm makes spores which land on my skin and get into my hair follicles, which can cause bald spots or irritation, and then before it leaves, it makes more of those spores that can be spread to someone else.
Yeah, that's correct.
Makes sense. Someone comes into your office, how do you know that they have ringworm for sure?
Well, usually I can tell just by looking at it, but there's several tests that can be done. One of these is the Woods lamp test, where we take the patient inside a dark examination room. We use the Woods lamp to let on the skin, and the infected skin will glow a very light color or very dark color.
Thank you, Dr. Tim, for appearing on our show tonight.
Thanks a lot for having me.
There you have it. I guess this plague really isn't as bad as we thought. If you have general cleanliness and take the right steps to prevention and treatment, it's a pretty harmless disease. Thanks for tuning in to Stand at Night. Stay classy, Ada.